Hello, everyone. So we'll just wait for a while before going and talking about today's live session. Like I'll just take some time of 5 to 10 minutes so that everybody just joins in, and then we can continue with the session of today's. Hello, Makwana Kishan. How are you? Thank you so much for joining this live session. Hello, Sadia Sheikh. Good evening. How are you all doing? So, guys, today's Krutika. Hello, Ekta. Hi, Priya. Hello, I'm good. How are you? So, guys, today's live session is all about again, we have come to talk with all the educators of Physiotrendz application who are joining, who are going to take your master classes, as well as me, who is going to take your biomechanics classes. And then we are going to talk about the classes, as well as apart from that, how the things are going on in the physiotherapy. And if you have any questions or doubts about application, about physiotherapy practice, about your career, anything, you can ask in the comment section, and that also we will try to solve in this session. So this live session is all about interacting with all of you in such a way that we get to know each other better, and so that we can have a better collaborations in the future. uh, Okay. My practicals are near. Any advice? Well, advice for practicals can be like be thorough with your skills. If you need any help, directly you can watch videos on YouTube channel, or you can directly consult me. Let's say we can help you out with that. Okay, so before delaying, let me introduce to all the educators who are there on Physiotrendz application right now. So I'll first add Dr. Srinath Vyas. So Dr. Srinath Vyas is MPT in sports and going to take master class for MSK. Hello, Dr. Srinath. How are you? Can you
Hello,
hear
sir.
me?
Good evening, and good evening, everyone.
Yes, perfect. Chalo. So Srinath, I'll just add other two educators as well, and then we can continue with our live session. Next, I'm going to add Dr. Purva Shah. Hello, ma'am. Good evening.
Hello everyone, good evening. How are you doing?
Okay, so ma'am is with us, and now next I'm going to add Dr. Maitri Thakur. Hello, Maitri. Good evening.
Good evening, sir. Good evening, everyone.
All right, so now we all are here, guys, for the first time on the Physio Trends. Like you are meeting us. So, whatever doubts you have about the application, about the master classes, or anything about physiotherapy, you can ask us, because here, right now, on the screen, what you're seeing is you can see all the specialty people. Like we have neuro also, cardio also, ortho also, sports also. So, any questions you have, you can ask us, and we all are. Obviously very well experienced, so that we can solve your doubts also. So if you just have any questions, put it on the comment section. By that time we will continue with our live session. So let's start with please, can you all introduce yourself? Let's start with Dr. Srinath Vyas.
Hello, everyone. Myself, Dr. Srinath Vyas. I am MPT in Sports Sciences. After I
Okay, is there a
completed my
connection issue from my side, or it is okay? Everything is fine, guys.
yeah.
Yes, yes.
Okay,
Yeah.
yes, Srinath, you can continue.
Yes, after my completion of MPT in Sports Sciences, I worked as a lecturer at Ames College, Ahmedabad. And after I have worked as a lecturer, I joined Sports Authority of Gujarat Football Academy as a sports physiotherapist. And I have also worked with the Gujarat State football team as sports physio. And right now, I have my own clinic in Ahmedabad, which focuses on multi-speciality physiotherapy.
Yeah, and recently I think you were also treating all the basketball player or something that we have seen on your Instagram reels. Something. Can you
Yeah.
tell us something about that?
Yes, exactly. I am trying to connect many people of many sports, as well as I'm trying to expand my versatility in many sports. So after working in football, I have ties with many sports such as rugby, basketball, cricket. So I am giving my services to local tournaments as well as state tournaments also in various associations.
Perfect. Thank you so much, and welcome to the Physiotrendz, sir. Next, I want Dr. Purva Shah to introduce herself.
Hello, physio friends. Myself, Dr. Purva Shah, and I have done my masters with neuro. And after that, I had my own private clinic in Ahmedabad. And after few years, I moved to Canada, and there I cleared my license exam, and then I was working as a registered physiotherapist in Canada. Right now, I have moved back during the COVID. I moved back to India due to some social reasons. But however, I have started seeing the scenario in India. I started that many people want to move to Canada. So I've started my personal coaching classes for PCE as well as NPT. Those are the license exam for you to work as a physical therapist in Canada.
Okay, so can you tell us about some of your experiences, that like how it was in working in Canada in compared to working in India? How it is different?
See, when we talk about patients, their patients are more knowledgeable. Like they expect much more than what we patients here expect. So they want
Okay,
us to be much perfect because they know what is when they come to us. They know partly about their condition. They much know much more about what can be done. So we also need to be much well versed in our knowledge when we treat the patients. Okay.
okay,
Scenario is changing over here too, but
mm-hmm.
compare there is a little bit difference in the patients.
Okay. So from patient, little difference is there, and obviously from the therapist like point of view, also some difference will be there.
Yes, they are using many different equipments also, which I have
There
seen
is only
later.
me now on the live session. Okay, there are people.
No, I can hear you.
Okay, now I can see you all.
Okay.
Okay. So now, my three ma'am, can you please introduce yourself?
Hello, am I
Yes.
audible?
Yes, Maitri, you're audible.
Yes, so good evening, all. First of all, thank you, Prem sir, for having me on Physiotrendz platform. I'm very thankful for that.
Pleasure
So,
is all mine.
my name is Dr. Maitri. Yeah. So, and I'm a cardiopulmonary physiotherapist, practicing currently in Gujarat. So I've completed my master's in year 2020, and so it's been around 2.5 years, and I've completed just before the COVID. So I got good opportunity to treat many COVID patients. And after my graduation, I don't wanted to limit myself to just one thing. No, so I wanted to explore all the areas. Like after masters, what I can do, like treating patients, teaching students, also taking home visits, also. So multiple things at the same time. So I've explored all these areas, and through that I've gained so much. I got to know so much things about the profession. कि like आप जो कॉलेज में पढ़ते हो, हॉस्पिटल में पेशेंट को ट्रीट करते हो, दैट इज वेरी डिफरेंट फ्रॉम होम विजिट, कि आप
Right.
घर पे पेशेंट को कैसे ट्रीट करते हो. ठीक है, और एक कार्डियो वाइज पेशेंट को ट्रीट करना, सो दैट इज टोटली डिफरेंट अप्रोच देन व्हाट वी आर गेटिंग टू लर्न इन आवर कॉलेजेस, इन आवर प्रैक्टिकल्स. सो वो सिनेरियो काफी डिफरेंट होता है. दैट इज द मोस्ट इम्पोर्टेंट थिंग दैट आई हैव कम टू नो ड्यूरिंग दिस टाइम.
Perfect.
या.
All right. So, guys, like as we all are on same platform right now, and we all are coming up with this application on Android phones, like, and we are going to be educators for all the physiotherapy students, not only from one place, but we are going to educate students from all around the world actually. Like today only, I have spoken with the application maker, and I have made sure that even somebody who is outside India, they can also join our application, they can also join our classes, and so that we will be like of course teaching international students as well. So this is a great platform we have got and great educators we have right now on the board. So let's say like you all are taking master classes. So can you all tell something about your master classes so that we can inform our students that what great things, what different things they are going to learn from the other parts in compared to like what they are learning anywhere in their colleges or in their clinics or right now when they are practicing. What different we are giving them? Let's talk about it. So can we start again from the Srinath?
Yes, sir, definitely.
Yes.
So talking about my masterclass, it is a MSK masterclass which is targeted at orthopedic non-traumatic conditions as well as sports injuries. Now talking in depth about the need of masterclass is that, see, after your post graduation, sorry, after graduation, when you're opting for some post graduation degree like MPT, and you also have some difficulties in topics of third year, final year, orthopedic non-traumatic conditions, and if you want a quick revision, like अगर आप एमपीटी के लिए तैयारी कर रहे हो और यू हैव सम लेस टाइम, बट कोर्स आपका बहुत ज़्यादा है, तो आप पढ़ाई कैसे करोगे? तो उसके लिए वी हैव ऑर्गेनाइज दिस मास्टर क्लास जिसमें बहुत सारे टॉपिक आ गए हैं एंड इन अ लेस पीरियड ऑफ टाइम, and it is also helpful to the people who are opting for NPT एग्ज़ाम, पीसी एग्ज़ाम, तो उसके लिए भी आपका क्विक रिवीजन हो जाएगा. ऑल्सो आई वुड बी टेकिंग सम ऑफ द क्लासेस फ्रॉम माई क्लिनिक जहाँ पे मैं आपको प्रैक्टिकल डेमोन्स्ट्रेशन है, स्पेशल टेस्ट है, सो आई वुड बी taking like that also, where your theory as well as your practical would be cleared.
Perfect. So that means like it's an whole and soul. So Srinath sir, like when you are starting your masterclass and it will
Yes.
be for how many hours?
I am starting my masterclass from 25th of May. The schedule will be out soon, but the classes commences from 25th of May and it will take around 6 to 7 hours.
Perfect. So in 7 hours, guys, you can revise your whole ortho. If you want to appear for any entrance exam test, or as sir said, if you want to go for license exams in the foreign countries, it can be a great help to take this master classes. Purva ma'am.
Yeah, basically, when I was doing my preparations for my masters, as well as my master entrance, as well as PC, I got to know that things are much more than what we need to, like. People would be spending hours and hours together to study. So then I realized that it's not it, that we need to study smart than work hard.
Yes.
So basically, this masterclass will help students to study in a smarter way, right? Other than that, what I realized is that people get scared of this neuro thing. Neuro aa jata hai, they feel like it's very tough. They get scared. So in my masterclass, I will make neuro more easier for them. Will help them to clear their basics. So that is the reason I'll be starting right from anatomy. And when we know our anatomy, when we know our basics much better, we know all the conditions better. So, for example, if there is a lesion in particular area of the brain, then we can understand we know if we know the function of that particular area of the brain. For example, the frontal area, right? If we know what the function of frontal area of the brain is, then we know that what if there is a lesion in that area, what will be the signs and symptoms. Okay.
Right.
Other than that, when we learn things with the help of some mnemonics or with some tricks and that makes things easier. So I'm going to teach neuro in a fun way so that people can remember it, and just that fear of neuro gets run away,
Then I
goes
should
away.
definitely join your master class, ma'am, because even I am scared of neuro, frankly speaking.
Yeah.
Not
My
scared
passion
of
and
it.
my love will help everyone to make neuro easier, and people will really love neuro again.
Okay, that's perfect. So even I will join this master class because even I want to
Sure,
revise my neuro.
welcome.
Okay. Dr. Maitri.
Yeah. So, talking about my masterclass, so I'll be covering starting from the basic to advanced techniques like exercise prescription. So, first, talking about the basics, I'll be teaching cardiorespiratory physiology. जिसमें कि इम्पोर्टेंट कंसेप्ट्स है जो हमारी बॉडी में लाइक फॉर आवर हार्ट्स एंड लंग्स कि गैस एक्सचेंज कैसे होता है, शंट, व्हाट इज डेड स्पेस, ठीक है, हाउ ऑल ऑफ दिस विल अफेक्ट योर ट्रीटमेंट पार्ट, ठीक है, जैसे कि बॉडी पोजीशनिंग है, सो ऑल दैट विल टीच इन डेप्थ, ठीक है. आफ्टर दैट द असेसमेंट पार्ट विल बी देयर, लाइक कंप्लीट कार्डियोपल्मोनरी असेसमेंट. और assessment में भी small small details the students will get to learn कि लाइक डिस्पनिया है, सो फॉर एग्जांपल कार्डियक डिसीज में डिस्पनिया कैसे डिफर करता है, पल्मोनरी डिसीज में कैसे डिस्पनिया डिफर करता है, ठीक है, एंड हाउ विल यू अप्रोच डिफरेंट पेशेंट्स, ठीक है, सीओपीडी का पेशेंट है, हाउ विल यू अप्रोच देम, हार्ट फेलियर का पेशेंट है, हाउ विल यू अप्रोच देम, ठीक है. देन फॉर द ट्रीटमेंट पार्ट, there will be much more than basic diaphragmatic exercise and postural drainage, and वो सब तो students को already पता है, ठीक है, like they already know, so there will be much more than postural drainage, percussion and vibration. कि अभी स्टूडेंट्स को क्या रहता है, चेस्ट फिजियोथेरेपी इज ओनली अबाउट पोस्चरल ड्रेनेज, पेशेंट को सुला दो और परकशन देने लगो, ठीक है. बट आई वांट टू जस्ट एक्सप्लेन दैट देयर इज मच मोर दैट दे कैन डू विद द पेशेंट इवन फॉर द एग्जाम पर्पसेस, ठीक है. तो बहुत सारे कंसेप्ट्स क्लियर होने वाले हैं, लाइक एक्सरसाइज टेस्टिंग है, तो व्हाट आर द टाइप्स ऑफ एक्सरसाइज टेस्ट, मैक्सिमल टेस्ट क्या होता है, सब मैक्सिमल टेस्ट क्या होता है, हाउ दे आर डिफरेंट, विच टेस्ट आर मोर बेनिफिशियल, प्रैक्टिकली आप पेशेंट को कौन से टेस्ट करवा सकते हो, ठीक है. आपके पास अगर कोई भी इक्विपमेंट नहीं है, इंस्ट्रूमेंट नहीं है, यू आर गोइंग ऑन अ होम विजिट, then how you can approach a patient. So practical way maybe this master class will help them to improve their practical skills also.
Amazing,
Yeah, so
amazing.
all
So
of
I think
things I'll
this
be covering.
master
Yeah.
class, before this master class only, we are getting to know so many things. Like okay, so like it's very exciting, and I guess like for all the students also, it's going to be very exciting. Guys, as you know that this master classes will be starting from different dates, and every dates and everything is also already mentioned in the application. So if you have not yet downloaded the application, you can go there in the Android application Play Store, download the application. You will get to know about all the courses what we have come up with. Platform gives you all like proper description also that from which date which course is starting, how many classes are going to be there, timings, everything. And the biggest advantage of this application, what is it? You know that? Anybody has any idea what is the biggest advantage? You can write in the comment section. Till the time you write it, we will have our communication going on, and then I will reveal that what is the biggest advantage of studying on this application of Physiotrendz. So guys, this is amazing. We all are on the same platform, and now let's talk a little bit out of the subject, out of the topic. Let's talk
Yeah.
about like okay, what is your experience about teaching students? What do you say like when you were a student and now when you are teaching students? What is the difference when you were a student and now current students? Because I am also teaching right now and I can see lots of difference. So let's start one by
And
one.
being a student is much easier than being a teacher.
Okay, what way? You don't have to worry, right? You just like it's like
You
you
don't
just
have to
wait till
worry,
there is
you can
yes.
gain whatever you want. You don't do whatever you want.
Yeah, and you have to study anyways 1 year, 1 month before the exam, so doesn't
Yeah,
matter.
that's it.
And for teacher, it is like every day going and taking class, making sure that everybody is studying, not studying.
लर्निंग नेवर एंड्स एंड हमारा भी रिवाइज हो जाता है.
Yeah,
It
that is
Yes,
is
true.
that is true.
it is a never ending process.
That's the biggest advantage of being teacher. Like you can be like upgraded all the every year, like
Every
some
time.
or
We
the other
also
thing.
have to be updated to
Every
the
time you
recent
teach a topic,
articles, recent advances. वो भी हमको पढ़ना रहता है.
Yes, that is true.
every time you teach a new topic, you feel that you're doing it again. You are learning something new from the same topic.
Yes, yes, yes. And that's what I used to do in my UG PG days also. Like because I was from Gujarati medium and went to this Mangalore, and there obviously nobody speaks Gujarati. Right now also I'm in Mangalore only. So when I speak to all of you, like I feel very good. Like okay, I have somebody to speak in Gujarati over here. But yeah, that's a different point. So when I came here, like even I had some batchmates from Gujarat, so we were finding very difficult to understand in English, like immediately. So what we used to do, like one person will study something and they will try to explain it in the local language. So that was something really helped to understand as well as teach, and I think like that is how I became a teacher from the UGPG days. That's my experience.
Right now in my coaching classes, everyone is Gujarati. So when they doesn't understand something in English, they'll ask me, "Ma'am, can we do it in Gujarati?" And sometimes I also prefer to explain them in their own language, so that
Yeah.
helps to remember things in a much better way.
And you won't believe, guys, like I'm getting so many comments from students also right now that can you take this master classes in Hindi language or common language so that they can understand in a
Yeah.
better way. And I keep on answering them the same thing. Like, see, when your master class starts, you can talk with the faculty who is taking it, and they will
Yes.
definitely help you out to make you understand in the local language as well as in the English language. So it will be common for like everyone. So that is also one
Yes,
of the
that will
advantage I
be
guess,
very
of this
helpful.
master class.
Yes, that
Yes.
helps.
And sir, what I say is we have been in this place before, so we better know that what difficulty do students face.
Yes. 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 Yes.
क्योंकि
And that
सर
is the
अभी
exact idea.
बहुत कम टाइम में वी हैव टू डिलीवर मोर, वी हैव टू टीच देम, वी हैव टू एजुकेट देम बाय द बेस्ट मीन्स, प्रैक्टिकल एस्पेक्ट्स भी होते हैं, सो दे विल गेट
Hmm.
एवरीथिंग अंडर वन रूफ इन दिस मास्टर क्लास.
Right. Advantage. Okay, nobody is talking about the what biggest advantages. But okay, then I'll tell you guys that the biggest advantage what you have on this Physiotrendz application is that all the classes recordings you will get after the live class. So if you want to go back and refer it, how much ever time you want to refer it, you can refer that knowledge, and that you can continue doing it. Like whenever you have any doubts, you just open the recording. You can start. You can continue with it. Like you can learn from that. So that is the biggest advantage of being on this Physiotrends application, which you will not get anywhere else. What do you
Yes.
say, guys?
इट्स परफेक्ट.
Right?
Perfect.
Okay, so and yeah, one more thing. I guess almost like as we had introduced this application, we launched this application on 1st of May. We gave initial discounts to everyone, and the special discount was given to the first 100 candidates. So now almost we have reached up till the 80 students benchmark. So hardly like 20-30 seats are left now for the extra discount. So I would suggest that all of you just start booking your seats as early as possible so that you can take advantage of that extra discount. And on the master classes, actually, those discounts are more in compared to my classes. My classes are like small classes about biomechanics and all. For master classes, you get extra more discount. So don't miss that chance, guys. You can, and one more advantage is you can avail that discount on all three master classes as well. It is not that one time only you can use the coupon. You can use that coupon on all three master classes. So again, that's just the introductory offer that you can take advantage of. Apart from that, guys, if you have any other doubts, you can write in the comment section, or else we will just end this live session and see you all on the Physiotrends application after a few days. This people are like right now, whatever our viewers are, they must be thinking like, what should we ask right now? Okay, any of you have any doubts, anything to ask? Srinath, Maitri, Purva ma'am. We have 5 minutes of time because I thought we'll take 30 minutes of live session. It's almost 25 minutes. So we
Hmm.
can still talk for 5 minutes.
So
So
I would like to just add one thing over here. So to our students, I've seen, many students they run away from cardio. So I don't know why they have such a fear, or there's a stigma exists between them. I don't know why. जब मैं भी student थी, my batchmates were like, I knew that मुझे cardio ही करना है, but everyone was like क्यों करना है, और भी अच्छा है, दूसरे फील्ड भी explore करो. But what I thought was कि इसमें बहुत ज्यादा अपॉर्चुनिटी है, एक पेशेंट सेटिस्फेक्शन है. कि आप आज पेशेंट को ट्रीट किया, एक्सरे देखा, टुमारो अगेन यू विजिट दैट पेशेंट, आप जो एक्सरे में डिफरेंस देखते हो, इट इज लाइक अ बिग डिफरेंस कि पहले जो हेजी पिक्चर होता है दैट गेट क्लियर, तो पेशेंट को भी इतना सेटिस्फेक्शन मिलता है, यू ऑन योर साइड गेट दैट सेटिस्फेक्शन. So I just want to tell all the students कि there is nothing like difficult in this field कि जो phobia है जो students के मन में कि नहीं अभी कार्डियो नहीं करना है, that is very difficult. ICU environment होता है, infection का chances होता है. So there is nothing like that. The most important thing is job satisfaction. आपका patient का satisfaction. So that is the most beautiful thing about this profession.
Yeah, that applies
So
to
that
all the
they should
conditions
think
which we
about.
treat.
No, and the
Yeah.
most important thing is what Maitri, what I feel is, what I have felt over the period of time is, no subjects are difficult or boring. Those who teaches, that matters a
Mm.
lot. Like if your teacher
Yeah.
is interesting, if your teacher is teaching in the interesting way,
Yes.
then the subject becomes
That is
interesting.
very
Yeah.
important. Hmm.
How
And
we
that
make
is
it more
why,
creative. Yeah. So
yes,
that's
and that is why this Physiotrendz platform, we all are here because we
Yes.
all are
We all love
creators.
our subjects and we will
Yes, we
make our
all are.
students love them too. Right?
we are more
Exactly.
passionate.
Yeah.
Yes. So our passion, our interest, our creativity will reflect in the students as well. Because we
Yeah.
love our subjects, they will also love that subjects.
Yeah.
That is the best thing about it.
That is true.
Yes. Okay, so one question has come, guys, by Krutika Gawad. Krutika, first of all, thank you for asking this question. Explaining peace protocol. Well, peace protocol right now it's the latest thing which we are following, leaving apart like rice protocol which we used to follow before police protocol, whatever we had. So peace
Yeah.
protocol basically is for the acute conditions that we follow. P for protection, E for elevation, A for again avoiding anti-inflammatory drugs, and C for compression, and E for educating your patients. So
Yeah.
basically here the main component of this peace protocol is that avoiding anti-inflammatory drugs, because according to the recent researches they have suggested that whenever you apply ice or take anti-inflammatory drugs, basically you are trying to delay the healing process of the condition, and that is the main thing that why we are avoiding these anti-inflammatory drugs. If I give you one example of this, let's take example, simplest example we can take for the acute ankle sprain, in which first of all definitely compression elevation is required because to avoid swelling as well as to avoid further injuries. Apart from that, educating the patient is also important. Okay, and protection from other injuries, like again recurrence of the injury, that is the most important part, and that is why we follow this peace protocol for the acute injuries. So I hope that you got idea about this and it helped you for your question. Srinath bhai, ekdam perfect tha answer.
Sir, ekdam perfect.
Okay, because you are on field all the time, so you must be
Yes, sir.
following this more oftenly, right?
Yes, sir. And one more thing I like to add that is that nowadays they have started using optimal loading, which
Yes, yes, yes,
reduces
yes.
effect of mechanotransduction, which will add up to your healing process.
Yes. So right now that's what peace and love protocol,
Yeah,
right?
peace.
Peace and love protocol we are following. So it's not only peace and love in which optimal loading also is getting added up. So yes, so that's something which is like updated thing that you have to follow for the patients. All right, guys. Yeah, you're welcome, Krutika. So she was there to hear it, and I'm glad about it. So, guys, it was a fun, fantastic live session, and I hope the students are getting maximum benefits out of it. So, once again, if you want to grab this opportunity to learn from all of us, go on Physiotrendz application. The link is provided in the description. You can just go download it, and then you can subscribe for our courses. Okay, thank you so much, guys. We'll see you around. Okay, bye
Wish
bye.
you
Good
all the
night.
very
Bye
best.
bye. See you.
Bye.
Thank you so much. Bye bye. Good night.
Bye.
Bye. Good night, everyone.